I'm Autumn Lockett.
And this is Mitch Randall.
And you're listening to Good Faith Weekly.
Welcome to Good Faith Weekly. And on this episode, Autumn and I are going to catch up and we're going to hear all about her grand adventure at Glacier National Park. And then we're going to talk about the end of the Afghan war. Lots of bad things happening at the Kabul airport, as well as refugee resettlements. Great need there. And then we're going to talk about the continuation of a rapid spread of the Delta variant in COVID-19. And then later on in the pod, Autumn and I sat down with a pediatrician, Dr. Jared Beavers, and talk about how parents can protect their children as they send them back to school. So stay tuned. It's a good episode.
I'm Reverend Starlette Thomas, a womanist in ministry and the host of the Raceless Gospel podcast from Good Faith Media. It's season 2, and we're still talking about that taboo trinity: race, religion, and politics. This season of the Raceless Gospel has 8 episodes, 8 podcast church services. The doors at this church are open, and we're going to talk about the sticks and stones we carry faithfully that break the skin and bones of Christ's body. And on each episode, we're joined by those who bring perspective and insight as to how we set these broken bones and perhaps make things right. The Raceless Gospel Podcast, 8 episodes. I'm your podcast pastor, Reverend Starlette Thomas. Join us as we discuss the church in North America's bodywork. Learn more at goodfaithmedia.org.
Autumn, welcome back to civilization.
Thank you so much. I never realized there were still places in our country that were so remote that your cell phone would be a literal brick.
So it was just dead weight that you carried around in Glacier?
Yes, it was just a camera. It was back to the old days when you just carried a camera and it couldn't do anything else. It was so beautiful. I'd seen pictures of Glacier National Park, and the pictures just do not do it justice. It was amazing.
Well, I know that you posted some pictures on your personal Facebook page as well as Good Faith Media's page, and it looks stunning. I mean, just gorgeous, gorgeous scenery.
Yeah, it really was. And I've actually really terrified my husband because I really enjoyed hiking. And I've never been an outdoorsy person before, ever, but I liked the exertion. I liked the sort of prime cardiovascular situation because you get your heart rate up and you sort of walk on level and then you get your heart rate up climbing. And so I have hydrating backpacks on the kids' Christmas list, and I'm ready to start hiking places. And my husband is not real happy about that.
Well, I remember kind of poking fun at you a couple of weeks ago, kind of worried about you because, as you just said, you're not the most outdoorsy type, but
I'm not. But you know what, Mitch? People can change their minds about things.
That's very true. Very true.
They can. And we encourage people at Good Faith Media to take in new data and to make informed new decisions.
Now, from what I understand, it was the standoff with the goat on the trail that really changed your mind.
I know I sound like a cartoon character, but they were so fluffy.
And when I say goat, I'm not talking about a little farm goat, right?
Oh, no. This was a big goat with like deep fur, and it just ran straight up the mountain like gravity wasn't even an issue. It was beautiful, just like the sound of music.
And goats weren't all the wildlife you saw.
No, we saw both kind of bears. We saw a grizzly and a black bear. We saw an elk. We saw a moose. We saw marmots and chipmunks and ground squirrels, and basically any kind of wildlife they had at Glacier National Park we saw and have video evidence of.
Well, I've seen that video evidence. It looked remarkable. So, what was it like? I mean, we have these experiences at Good Faith Media, and, it's kind of strange that a media company encourages their supporters and listeners and viewers to really unplug from media and go into these national parks. What was it like to unplug for an entire week?
It was life-giving. We have been so extremely plugged during COVID because these machines are the only way we can connect and do our work. And so it was really sort of healing to be in a place where my phone was at pinging and ponging the whole time. And then just getting to spend time with people of all different generations and life stages and professions who have a heart to truly be a Jesus follower, and to listen to them about their professions and really talk and connect with people was just really, really life giving. If you have an opportunity to go on a Good Faith Media experience, you absolutely should.
Excellent. Well, I'm speaking of unplugging. Lots of heartache coming out of Afghanistan last
Mm.
couple of weeks. Biden administration announced a few weeks ago that they were keeping the deadline for a complete U.S. pullout of August the 31st. And since then, the Taliban have basically taken over the country. There has been a mad rush to the Kabul airport where thousands of Afghanis are attempting to get out of the country, some clinging to the bottom of planes in
Mm.
hopes of getting out. That has created a complete humanitarian crisis. There's a huge refugee resettlement program that is underway right now, and it's just been heartbreaking to see.
Yes, I just wonder how many times in our lifetime we're going to have to talk about refugees.
Oh, I think we're going to be talking about them every year because there is a huge global catastrophe taking place. I mean, what we're dealing with right now is war and the
Mhm.
displacement of victims of war. And that's not going to slow down anytime soon. But there's also the added component of climate change
Yes,
and
yes.
people reload. I mean, we've talked about, refugee crises in the world. I think that there's a human migration taking place,
Mhm.
that
Mhm.
humans are migrating to places where there are resources, where they can simply take care of their families in a safe manner. And they hate leaving their homelands. They love their homelands. And Ahmad and Chauncey writes about that this week at goodfaithmedia.org
Mm.
about, no refugee wants to leave their home. It's their home, for crying out loud. But when they do so the simple fact of finding resources and opportunity for their families. And so it's just heartbreaking. And when war is involved, this was a choice that we made 20 years ago to enter Afghanistan, and we've made choices ever since then to stay there. And I was talking to Mark Wyatt a while ago, who's a CBF missionary who's in Raleigh, North Carolina, who oversees the Welcome House there, that is a refugee house that transitions refugees into the communities. It's a wonderful, wonderful program. And he reminded me in our phone conversation when he simply said, he said, Mitch, this is what the end of war looks like.
Mm.
And he's absolutely right. I was
Yep.
a child when the Vietnam War ended, and I was a small child when the Vietnam War ended. But I do remember in my church back in Tulsa, Oklahoma, many Vietnamese children and young people flooding into our church. And he's exactly right. This is what the end of war looks like. And the question is, do we have a responsibility to take these refugees in, to care for them, and help them transition into a new life? Because the life that they are forced to live with if they remain back in Afghanistan, that is not a good one. The Taliban
No.
will retaliate.
Well, and it's really a shame the Bible never really told us what to do with refugees, widows, or children who were in need of homes. I mean, it's just real unclear on
Yeah, it's
that.
very unclear. I mean, I wish they could have been a little more concise. I mean, yeah, I think Jesus said maybe he may have mentioned it a time or two, but it was not
That
really.
guy.
uh, no, as people of faith, we are called, I mean, over and over again in the scripture to take care of the stranger and to welcome the stranger and care for them and show hospitality. That is a part of our theological foundation and
Yeah.
understanding. And we need to be doing this. We have responsibility. And so Mark suggests starting with your local refugee settlement organization and seeing what is being done there. He said because of the Afghan situation, usually it's about a 2 week notice when refugees get to come into the state. But now they're getting a notification of 1 day.
Oh
One day
gosh.
refugees may show up in your community. And so there's a desperate need for homes and rooms. And so, uh, so Mark suggests starting with your local resettlement organization. And if you don't have one in your area, or if refugees are not being resettled in your area, there's certainly other cities, other organizations like the Welcome House in North Carolina and CBF's refugee program that you can support. So it's certainly a lot of good happening. This is an opportunity for people of faith to really to do what is right, and I hope that we all rise up and do so.
Yeah.
Well, speaking of doing what is right, school's back in session. Delta variant COVID-19 is not slowing down. And there's a lot of people who are still not choosing to do what is right and avoid the vaccine, not implement mask mandates in local schools. And it's just heartbreaking. The
Ins-
numbers are going
and
through the
ins-
roof.
And instead, they're just depending on horse dewormer to solve their problems.
When the CDC, I think it was the CDC or FDA, released a statement saying, people, you are not horses. Do not take this. What kind of world do we live in when you have to say that?
I don't know how you have mistrust of medication for people that's been through lots of testing and research for how it affects people, but you would trust a veterinary supplement that was never meant to be ingested by people, right? It's used topically to treat lice and rosacea on humans, but in very small doses and different doses than people are buying at the feed store, which is what we're seeing right now.
Yeah, I just don't get it. I just don't get it. Well, you have sent your children back to school, Autumn. You've been talking to parents. How's it going?
Well, it's going pretty well. I've sort of fretted about it all summer, and as we saw Delta start to peak, I didn't know what to do. But after talking to pediatricians and our life and specialists, we made the choice to send our kids back. They are in masks. Our oldest is in high school, and she reports that all of their staff, all the adults at the campus that she is on, are wearing masks,
Excellent.
and that she's wearing a mask, and that it's actually been pretty nice for her to be able to pick out friends in high school who who are compassionate, kind human beings based on mask wearage. So I'm like, that's actually kind of nice. Would have been nice in high school to not have to fill that out. My little ones are at a school where they have lots of outside time. They're in masks as well. And then my elementary student is he's in an N95, and he is eating lunch in the office, sort of away from that super spreader experience.
Well, good. Well, I'm glad they're staying safe. And it sounds like a majority of folks are taking this very seriously. And I know there's a lot of concerns out there, and rightly so, by parents as they send their kids back to school. We are seeing the numbers continuing to increase. Children's hospitals are starting to fill up. ICU beds are at capacity, and it is an alarming time. The vaccine works, folks. It's got full FDA approval now. So those of you who have been holding out for that approval, it's here. Go get the jab. For those who need boosters, it's available now, or the elderly and others. So please, let's start taking care of ourselves. We got to bring this thing to end. That's the only way it's going to come to an end, is through vaccination and increasing those rates. Well, Autumn and I had the pleasure of sitting down with Dr. Jared Beavers this week, who is a pediatrician out of Little Rock, Arkansas. And Autumn had the wise idea of doing some not consulting, but
Crowdsourcing.
crowdsourcing. And we got some great questions from our Facebook followers that we posed to Dr. Beavers, and he answers those, and he does it in a very great and kind way and thoughtful way. So it's a great interview. So stay tuned for Dr. Jared Beavers.
I'm Reverend Kendall Ray Rothis, and my latest book is just out. Thy Queendom Come, Breaking Free from the Patriarchy to Save Your Soul. Thy Queendom Come is a feminist reimagining of the kingdom of God. Hierarchy is replaced with a reign of love. Women's voices and stories are valued. Reverence for the divine feminine reemerges from the ashes of its martyrdom. Order your copy of Thy Queendom Come wherever books are sold.
Welcome back to Good Faith Weekly. On this episode, we've got a very special guest with us all the way from Little Rock, Arkansas. Dr. Jared Beavers is currently an associate professor and hospitalist in pediatrics at the University of Arkansas for Medical Sciences. Dr. Beavers also practices neonatal intensive care at Arkansas Children's Hospital. Dr. Beavers is currently a member of the American Board of Pediatrics, Alpha Omega Alpha, Christian Medical and Dental Association, and the Arkansas Medical Society. He lives in Little Rock, as we've already stated, with his wife Blair, who's also a pediatrician, by the way, and their daughter Emerson. Dr. Beavers, welcome to Good Faith Weekly.
Well, thanks for having me. Appreciate it.
We are so glad that you're here. How old is Emerson?
Emerson is now 8, and they probably haven't updated that dossier, but it's, I actually have a 6-year-old named Bennett as well. So
Oh, nice.
she's busy.
Excellent. That's great. What's it like living with another pediatrician? You guys are you in competition with one another?
The funny thing is, so back in the day, we actually did training together, and that was a true test on our marriage. There were times when we butted heads, professionally, not just as husband and wife, but it was a little bit of a challenge. But now, I really couldn't ask for anything better. I've got an instant consult. If I'm kind of losing my way, I can turn to her and ask her a question, and she doesn't turn to me for questions, because she's smarter. But I think that it's nice to have that partner that you can do life and career with. So it's kind of
Absolutely. Well, Dr. Beavers, you're here today because the Delta variant and kids heading back to school. You live in Arkansas, which is a hotbed for the virus right now. Just first of all, how are you and your family? Everybody okay and healthy?
Yeah. So far we've managed along pretty well. There have been a couple scares along the way, and certainly, being in healthcare every day is a little bit of a challenge now, but we've remained pretty healthy. And so we're very thankful for that.
Excellent.
Excellent. So what Mitch and I have done is we've sort of put together some questions of things. So we've been wondering things that I've asked our pediatrician, and then also sort of crowdsourced some parents on social media. And this is sort of a list of the questions that were the most burning and at the top of their list. So I'm just going to kick it off. And they're probably things you've been asked in the office quite a bit in the past 19 months or so. We know that masking and distancing are essential tools in helping slow the spread of COVID. And we know a lot more about that now than we did in March of 2020. But what other tips would you recommend? What are you doing at home with your family?
Ooh, that's a great question. So, masking, distancing, I think when we're talking about all of those protocols and all of those little things that help protect us from the virus, it's all layers of protection, and so the number of layers that you can get between you and the virus, the better. And I'm not just talking about layers of, mask or layers of, cloth or anything like that. It's just physical, but also temporal layers. So, if you can, time activities, to where there's not going to be a crowd, for example, like when we go out to a playground with our children, we try to go, in an off hour where there's not going to be a lot of kids, around that could potentially, be interacting too much with them. It's a hard balance, between wanting your kids to have that socialization, and that friendship and camaraderie. But also trying to caution them and be very careful with regards to spread. We do encourage them whenever they're going to be around, other kids and stuff, that we're going to wear our masks, if we're not if we're not outside. For outside activities, just telling them, let's not have any physical contact, but you can certainly run around and jump and play and do those sorts of things with the other children. As far as other precautions, I think, the CDC's laid it out pretty well. And I know that there's been a lot of kind of controversy, or at least disgruntlement with the mixed messaging the CDC has had, in past months. But I think it's all been fairly, consistent with, trying to maintain that physical distance, trying to wear your mask, when you're indoors with other people. And also, again, just not doing anything that you don't necessarily have to do, especially with the variant raging through our community right now. Just not going out and about and just avoiding as much contact as you can.
Yeah.
Dr. Beavers, this is the third school year that's been affected by COVID-19. A lot of kids already back in school. Some kids on the East Coast, West Coast will be arriving in school in September. A lot of nervous parents out there, obviously. So, what guidance do you have for parents who want their children to have the benefits of in person learning, but also want to mitigate the risk of COVID-19? And I'm going to give you a specific example. And I heard this just last night from a parent. How risky is it for how risky is it for elementary children to be masked in a classroom where a teacher does not wear a mask?
Well, that's a good question. So again, if the teacher is not wearing a mask, you've removed a layer, between, that teacher and that student, and so I think it would be ideal, if teachers and students were both masked, had those physical barriers in place. When we talk about risk, it's really hard to put numbers on this. This is not something that's well defined right now. I mean, even though we've been kind of in this for 18, 20, 24 months, we're learning things every day. The problem with masks and those barriers and the difficulty with studying them is that there's no two masks that are alike, and the cloth mask that I'm wearing, when I go out and about is different than the surgical mask that I typically wear while I'm making rounds in the hospital, which is different than the N95 mask that I wear when I see COVID patients. So there's a lot of variability, that plays a big role in how much risk there is. So I think a lot of it kind of boils down to just common sense things. Of course, the teacher not having a mask on increases the risk, but the risk is fairly small. I think the most important message that I would give to parents, with regards to their kids going back to school this fall is I'm nervous too. Okay, I'm a pediatrician, but I'm a parent. Everybody's nervous. That's absolutely fine, and that's a very real and very common and okay feeling. I mean, it's okay to feel that way. I think if you didn't feel that way as a parent, I would be really concerned about you. I would worry about your bonding with your child. But the risk is fairly small. Okay, the risk overall for children is still fairly small. And so when I say fairly small, the chance of transmission from child to child as asymptomatic carriers, there's been some studies in the last year that have looked at that, and as asymptomatic carriers, kids don't tend to spread the virus nearly as much as adults do. So once you get up into the adolescent and adult years, the chances of spreading that virus increase quite a bit. And so the risk for especially smaller kids, elementary school age kids going back to school, the risk of asymptomatic transmission is pretty small. I think what parents are seeing mostly in the news right now is all of these kids in the children's hospital. All of the children's hospitals filling up, lack of ICU beds and things, and certainly that's something we've been seeing here in Arkansas. Again, those cases are still pretty rare, but they're it's just like anything in pediatrics. One case is too many. And when any family that has a sick child, just like any person that has a sick relative, it's painful, and it's just a distressing situation for them. So I always say one case is too many. And if it's your child, you would agree. So I think just doing everything we can to maximize the safety for our children, but also kind of promoting that good education. And I am all for in-person education. I'm the son of a school teacher, two school teachers actually, and you'll never find a bigger public school proponent than me. But I also think we have to do it safely, and so keeping those protections in place, having some common sense about the things we do to help keep those kids safe is paramount to helping keep those hospitals empty and keeping those kids healthy.
Yes. So there's been a real uptick in RSV lately, and it seems sort of off season. Do you have some thoughts on why that is? And how can a parent tell the difference between COVID and RSV, because they look very similar?
I can tell you, you Google it like we do at our house.
Yes. Yes.
Yeah, so WebMD does not all work. So
Suddenly your daughter has prostate cancer, and there
I
you
know,
are.
right? Man, that escalated quickly. That's a great question. So kind of two parts to that question. The RSV and influenza basically disappeared last year. in children. There were the number of cases, if you go look at the CDC reporting statistics for those cases, it's almost like they just vanished all of a sudden. And it was because of social distancing and masks. Those viruses are spread more commonly through respiratory contact, respiratory droplets. COVID is spread, predominantly through respiratory droplet, but it can also be aerosolized. It can also be spread through tinier particles, which makes it more transmissible than those other two viruses. Which in turn also makes it somewhat more deadly because it can spread from person to person easier. And so what you see in the reporting is that those viruses disappeared because we actually did a big social health experiment with distancing and masks, and all of a sudden, those cases are gone. You look at in Arkansas, when the mask mandate was removed, RSV and in some small cases influenza, but mostly RSV came surging right back. And that's because kids started mingling again, and those viruses are spread. We all, as parents, know that kids are petri dishes, that just love to spread their lovely germs everywhere. And so that's what we saw. We saw RSV come surging back. We saw these surges in COVID cases. That's what's happening is people are mingling more, and those viruses that replicate and transmit and live in populations can do so more easily. So that was the big spreader, and the reason for the off-season kind of surge that we've seen was because typically when you go inside for the winter and you're driven indoors, that's when you're going to get most transmission. It doesn't usually happen, in the summer months because we're usually outside, and have a little bit more distance and a little bit more fresh air. But we've seen it now because people are mingling and our immune systems are primed to receive those viruses. And I think with and the second part of that question, I got a little off kilter there. So I guess with how do you tell the difference, between virus types? It's really hard. It's really, really impossible. And truth, okay. the only way you can tell, is with testing.
Okay.
And if you've had, the frontal lobotomy that is a COVID test, it's not. Oh, yeah. You know that it's not the most fun test in the world. But I think in this climate, with the population spread that we have right now, it is very important where if you suspect that your child has a viral illness, to talk to their healthcare provider, to get testing, and sometimes there are some at-home kits that some providers are using, some blood tests and things like that might be a little bit less troublesome. But talk to their provider and get testing, because especially if they are in a school setting, we don't want transmission to take place. Right. Because eventually that virus will find its way to a susceptible person and will cause them great harm. And so we want to make sure that we minimize that. But fever, cough, runny nose, all of those upper respiratory viral symptoms are common across influenza, RSV, coronavirus, all of those.
Yeah.
Dr. Beavers, we got a question from one of our followers, and she asked, would you advise masks for all ages of children? Should they be masked if outdoors? Early on, we wore masks no matter what, but eventually the guidance was that the virus was less efficiently transmitted outside. She's specifically asking about playgrounds, water parks, and pools.
Great question. As I said before, playing outside, I'm not so concerned about masks. When you have lots of airflow and studies have kind of supported this ventilation with good, fresh air kind of moving through, the risk of transmission is already extremely small. I think certainly, if you are around someone who is known to be immunocompromised, we have some grandparents, that our girls love to see. One of which, is on as a cancer, patient. If you're around someone that has an increased risk or susceptibility to infection, I think it's never harmful to put that mask on for a few minutes, especially if you're going to be in close proximity, indoors or out. But I think by and large, water parks are an interesting animal. I would say your risk of transmission for everything goes up at a water park. So I mean, I think when I say kids are petri dishes, water parks are it's just a culture tube. You're just sitting there, spreading literally everything. water park. So nothing against water parks, but I mean, man, they're not clean places. I think that, taking, again, those common sense precautions, I think masks are good for all age groups that can comfortably wear them.
Okay.
Kid is less than 3, trying to keep a mask on a toddler. I mean, you're going to lose that fight.
Even keeping a diaper on a toddler can be a challenge.
Yeah, they're gonna chew on that mask, and they're gonna put everything in their mouth. There is almost zero chance that you're going to promote a safe mask wearing with a 2-year-old. And that's what CDC guidance says. If you're less than 3 and can't comfortably wear a mask, then absolutely don't worry about it.
Okay.
The risk for those children are small. Again, the risk for kids is still low. It's higher with Delta, but it's still not, at the adult levels. So I think that less than 3-year-olds and stuff, per the guidelines is absolutely fine to go without a mask. Unless you're in a situation like on a plane or whatever that they, if they say otherwise. So
Sure. So when do you, I know this is the question, right? When do you think we can expect a vaccine for our kids who are under 12? And what is your guidance as far as parents potentially spacing out that vaccine from like the flu shot or their routine immunizations?
Good question. So, if I got my crystal ball out, and I don't mean to toot my own horn, but I've been pretty accurate with my predictions as far as, vaccine timing goes. And it's not because I'm smart. It's because I have really, really smart friends.
You ask your wife, basically.
And I've got a wife that, keeps me online. So right now, what we've heard is, of course, the FDA said that it would be early to midwinter, whatever vague time that is referring to. From what we understand in the healthcare community, the earliest we would expect to see a vaccine approved for children less than 12 would be in October.
Okay.
And I think if we get it in October, that would be, again, just a landmark. This vaccine, I'm going on a little vaccine tangent for a second. This thing is just absolutely remarkable. And I'm such a science geek. I love talking about this with parents. What these companies have done, the interface between government and private industry, but also just the scientists working, long hours into the night. They've created a vaccine delivery platform that is easily modifiable. That you could change, the vaccine, the mRNA, sequence in the vaccine to tailor it to any virus, that kind of comes around, really at the drop of a hat. It's remarkable in its simplicity. This isn't a big, crazy, experimental thing. It's been researched for, going on over a decade now. And they've created this platform. And what we're seeing is, of course, there are some side effects, sore arm, fever, headache, some of those things that we see from an immune response. But it's remarkably safe and it's remarkably effective. And it's just going to be, I think, here to stay, with regards to how we vaccinate and how we keep people healthy and from contracting these diseases. And I've told people on social media and in my day-to-day conversations, my 8 and 6-year-old will be at the front of the line when those vaccines are approved for those groups. I cannot think of anything as a parent that I could do more of to make them more safe than getting them vaccinated against this virus. I would feel the relief I had when I got my vaccine, January. I mean, seriously, it was like a weight had been lifted off my shoulders, because as a practitioner, as a healthcare worker, seeing these people get sick, seeing these people die, seeing, friends and relatives and all these people struggling with this virus, it was a weight off my shoulders to know that I was protected, and yeah, there's still that really rare chance that something could happen, I could still get infected or still be hospitalized. But man, I've really done everything I can. And now it felt like I'd put on my armor, and I could then, kind of go out more safely. So it was just a huge relief for me. And I can't imagine as a parent, what that relief will feel like, knowing that my kids have been protected.
Yes.
Dr. Amber Schmidtke, who's an epidemiologist, former employee of CDC, is a friend of our podcast. She's been coming routine guest since the pandemic broke last
She's
year.
sort of like the medical Holy Spirit of our podcast. So we just have her floating through here, dispensing her knowledge.
There you go.
But you just echoed exactly what she's been saying about
Yeah.
this vaccine. It really is it's a modern day miracle in medicine because how quickly they put this together and the ability just the vaccine itself is remarkable. And she's told us behind the scenes that there are going to be things that come out of this moment that are going to be life changing for everybody because of the research that's been done to bring this vaccine to everybody.
HIV patients, all these other things. We've been waiting for some kind of relief. Yeah.
It's going to be, I mean, it's a pivotal moment, and one of the things that, I've talked about with, I've got lots of family that are very staunchly, conservative, and it's a struggle, I think, between, faith and science. They grapple with a lot. But, one of the things they raised me, and one of the things that, when they had all these hesitations about vaccines and all this stuff, I was like, listen, you helped raise me. And you helped me through school and training and to gather all of the knowledge that I've been able to accumulate over these years. And when I tell you that when I've read all this stuff and that it's safe and effective, I'm not feeding you a line, from some organization or some, body. I mean, I legitimately have done everything I can to make sure that this is going to be good for us. And I would, recommend it without hesitation. And that's been what I've told a lot of family that have been hesitant to vaccinate. And I think it's really reached them. I think they really realize that, this isn't, it's not a lack of faith, in God's protection, by taking this vaccine. I mean, I think, that God has used researchers and scientists and given us brains and abilities, and it's just echoed. It is a miracle. I mean, this thing, I called it that, back in January when I got it myself. I just like, this is a modern day miracle. The fact that we've been able to develop this so quickly. And we are so blessed in this country. And that's one thing I don't know if everybody really appreciates, the resources that we have in this country. And the vaccination that we have, the vaccinations that we have available. Having 3 different vaccines, whereas some countries have 0.
Yeah.
It's just, it's remarkable. I think how privileged we are. And I really, really just encourage my family. Like, it's like, this is, something I think is good for you and to just go with it.
Yeah. Just to kind of follow up on that. You mentioned there is a hesitancy in all of our families. Some people are hesitant to get the vaccine. Hopefully now that it's been approved by the FDA, that some of those people who are on the fence are now going to get it. But there are going to be still some who just refuse to do it. And talking to Dr. Schmidtke and her educating us on the way this virus and any virus begins to evolve and morph because it needs to find a host. My fear is that those who are refusing to get vaccinated are putting our kids who cannot get vaccinated right now at risk. And that's why we're seeing the uptick in cases with children and children landing in the ICU. Is the number one way still to protect our kids as an adult getting vaccinated?
100%. Yeah, without any hesitation. Yeah, I mean, this virus, as you said, this virus mutates when it replicates. The more replications that take place, the increased incidence of mutation. Eventually, it mutates and it will escape the vaccine protection that we have. We're already seeing that, to a degree with Delta. The efficacy for the vaccine is slightly lower, but only about 10% lower. And we have variants like Lambda. There's a Lambda variant that was first studied in Peru, that in clinical studies in laboratory studies have shown some vaccine resistance. If we want to escape this thing once and for all, like if we want to get out of this once and for all, we really have to get a huge chunk of the population vaccinated or post-infection, and that's not a really reasonable alternative. To get herd immunity so that this thing will eventually just fade out, just like so many other viruses. Some of what we saw with the Spanish flu. The progression of viruses is that they will flare up, and then as people become immune, whether it's through vaccination or natural infection, and they will slowly subside. So there is an end to this. There is an end, to this, but it's going to be how that end looks can be very, very different based on vaccination versus no vaccination. Mm-hmm. We're going to be dealing with a lot of long-term effects from people who have been not vaccinated that have contracted the disease. There are going to be a lot of long-term sequelae that we're going to be studying for decades. And I think that the end point for us is dramatically different based on vaccination status.
Before I hand it over to Autumn, I got one little bit of a controversial question to ask you, Dr. Beavers. With the full approval of the FDA now, is it time to add this vaccine as a mandate?
Oh man, that is a controversial question. I think so. I'm a pediatrician, and I have seen and experienced the wonders of vaccination, and the protections that it provides. And I would love nothing more than 100% of my patients and their families to be vaccinated for everything that's possible. I don't think that we can mandate healthcare decisions like that. The reason I say that, and I say that knowing full well that that you're right. That's a controversial thing. I would love it. I would absolutely love to tell all my parents, well, I'm sorry, you don't really have a whole lot of choice in this. We have to get vaccinated. But I respect them as individuals, and I respect their autonomy enough to let them make healthcare decisions. And I know that it's a public health crisis, and in those situations, things change a little bit. But I still think that we have to be very, very careful with mandating healthcare and then how we do that. Again, it's a little bit of a slippery slope, with regards to, the involvement of agencies or corporations or anything like that. And I certainly think that industry, I don't think that having vaccine requirements are wrong. It's required for me to get vaccinated and for my day-to-day work. I have to, as a physician, I have to submit to getting vaccinated because that's, part of the policy at the institution I work at. I have no problems, with that. But again, I would have the freedom to leave and do another job if I wanted there. So I think that.
So let me ask you this, and this is really out of ignorance more than anything. This question comes, which most of my questions are, but so what would be the difference between mandating the COVID-19 vaccine versus vaccines that are already required for children when they enter school? And obviously we do know that there are religious exemptions to that mandate, but primarily they ask for vaccination records. What's the difference between this one and the others?
Yeah, in that regard, I don't think that that's a wrong mandate. I think that schools should be able to require it. I think that again, if you're going into a social contract with an institution or a body, saying that I'm going to do everything I can to protect my child and other children, by having them vaccinated in a public school setting, then I think that it's absolutely fine to have that requirement. We've had that for years and years. And yes, there are people that feel, differently, but if they have strong religious objections, then there's an exception for that. If they have stronger objections, then, there's homeschooling or private schools or alternatives. So I think that there are outlets for that. I just think that a universal mandate, I think that saying that, for you to exist, you have to have this vaccine. I think that is an overreach. I think that we still have to have the freedom to make decisions for ourselves, as painful as those decisions can be and as costly as those can be for our society. I still think that that's a fundamental freedom. but you're right. I mean, that puts me in a hard place,
Gotcha.
because I see the benefits and I see the good that they do. But I do think that, ultimately, we have to have, some of those freedoms in our decisions with regards to our health. At this, I don't want, I certainly don't want the government telling me how to take care of my patients.
Sure.
I don't want, I know there are definitely guidelines, and laws that I have to follow. And there are, some issues there, but in my day-to-day practice, if I had somebody looking over my shoulder, I would feel very, very concerned, that I would be able to take good care of my patients. So.
That's a great answer. So thanks for
It
it's
is.
a tough question, but you did beautifully. So before I go ahead, I got one more question before I hand it over to Autumn. Kids are going back to school, as we've already indicated. We've got Labor Day right around the corner. A lot of people getting together on that holiday. Is it okay for parents to ask their teachers, their adult friends, their family members about their vaccination status? And if they're unvaccinated, what should parents do? Should they keep their kids away from unvaccinated people?
Well, yeah, I think our whole culture right now is kind of grappling with that. We're really, the tension that has been created, between vaccination status or mask status or all of these, these pressures and tensions and stuff, that you feel, some of them are justified. A lot of it I think is certainly driven by exterior forces, be those political or otherwise disruptive. What I think most people want to know when they're asking, are you vaccinated or not, is, are you safe, to be around, or are you not? And I think if people appreciate that when people are asking those questions, they don't mean anything by it. It's not a political statement. If we give each other grace and understanding, are you vaccinated?
Yeah.
My kids, I don't want them having to miss school and stuff like that. I'm sorry. I know that kind of sounds like a crass question, but
I think it's absolutely accurate, because I can remember when my two boys were young. I mean, when we would send them over to a house that we didn't know the parents. I mean, one of the questions that we did ask the parents is, do they have firearms in the house?
Yep.
Yeah.
And I don't think it's inappropriate at all. In fact, one of the things that I've been doing, which I've had the strangest conversations on elevators these days, because I begin almost all my conversation with Pfizer. It's kind of like my new hello, Pfizer. And so usually people will respond with whatever they got. So.
That's right. Yeah. Yeah, that's exactly right.
Yeah.
But I think you're right. It's just, there are questions we have to ask as parents, to help us, feel more comfortable, that our kids are well protected and safe. And I don't think it's a wrong question to ask. I do think there's a delicate way to ask.
Sure. Yeah.
I think, you throw it out there, you go, I'm sorry, they can't come over if they're not vaccinated. Mm-hmm. I think being confrontational at this point is only going to drive people away. It's only going to cause further disruption and tension. I think, asking the right way is just as important as asking the question. And so how you ask, those sorts of questions is very, very, important for parents and families, especially with the holidays coming up.
So what if you knew that your family members weren't vaccinated, they were anti-maskers, and worked in a very public-facing job? Would you let your children be around them?
How many? I can't tell you how many coworkers I have that are in that situation. It happens every day in the hospital. We have, healthcare workers, just across communities who have taken care of COVID patients, seen, COVID people die. Even, and there are definitely some of them, that are the same way that don't, feel that the vaccines, are helpful or that masks work or that sort of thing. But I have so many other colleagues who are doing everything they can to protect their family, but they have family members, who they feel aren't. And that's created huge rifts, in their family, created huge amounts of tension. And I think, you have to believe in it strongly, or, you're gonna fold. You're going to cave to those things. I tell parents when they take a newborn home, I say, listen, these first few weeks, when people come to visit, I want you to ask them, hey, have you had your pertussis booster, in the last 10 years? Because that's one of the things that could actually hurt or kill our baby. And it's really important, that you get vaccinated for that before you come around the baby. And of course, not saying it like that, but
Sure.
the rest of it. And I think it's similar with COVID. It's like, listen, I'm in a healthcare setting. I could very easily carry, that virus, to my patients, or to somebody who's immunocompromised. So I can't let my kids, be the vector that brings that home, and could potentially put my patients, at risk in addition to my own children's health. Mm-hmm. We have to make hard decisions here. And one of those decisions right now is we're not going to have a whole lot of FaceTime with you guys. We'll be happy to get on tablets and talk and those sorts of things. But, in-person stuff right now is just too dangerous. I think taking the hardline stance is something we have to do as parents sometimes, even with our own parents. I think that's some of the most troubling things, that these generations are seeing, is that the generations that raised us are doing things that are completely antithetical to the values that they instilled in us. And that's hard. That's really hard. As a parent, you're like, that's not consistent at all with the way you raised me. And so that creates this, it kind of, creates this Twilight Zone effect where you're like, is this real life? And it just, again, those are just all tensions and social, pressures and stuff that people are facing every day. But I think that, having a principled stance on it and saying, we've got to do what's right for our family. And in that instance, we think that this is the right path. And I'm sorry that causes you grief and hurts you, but we have to do what's right. And I think most people will respect that. Most people, I think, will respect that, but there's definitely going to be conflict there.
Yeah. Yeah.
Well, Dr. Jared Beavers from Little Rock, Arkansas, pediatrician, just a great guy. Thank you so much for being a guest on Good Faith Weekly. It was informative, eye-opening, and we really appreciate your time. But before we let you go, Autumn's got one last question for you.
I do. Our tagline at Good Faith Media is "There's more to tell." So in light of everything that we've talked about today, what is your more to tell?
My more to tell would be, the FDA has approved the vaccine for everybody 16 and up. It's got full approval. This is not an experiment. This is a full-on deal. Everybody that can needs to be vaccinated, and we all need to take care of one another. Whether that's adding layers of protection like masks and distancing, bringing food to our neighbors who can't go out, whatever that looks like. We still need to be taking care of each other because that's how we get through it. We get through this together. And so I think that continue taking care of each other. I think everybody's tired of this whole deal, but hang in there. We'll get through it.
Well said, sir. Well said. Dr. Beavers, thank you again for being a guest this week. We are thrilled to have you. I'm so glad that we got connected through one of our board members, Dr. Kevin Hefner. We could spend an entire podcast on him, but we won't.
That is a different podcast,
Mitch. But we really appreciate it. Thanks for being on the show.
Well, thank you for having me.
And guests, listeners, thank you so much for tuning in to Good Faith Weekly this week. Until next week, keep living good faith.